Hello, everybody, and welcome to Irish Hypnotherapy Conference 2025 Meet the Speaker Series. Today, we are talking to Frederic Mao, all the way from the US of A. What part of the US are you in, Frederic?
I'm in South Carolina, and we are a part that actually has palm trees, whereas North Carolina, which is next door, does not. So if that helps you kind of set where we are, we're on the East
In other
Coast.
words, you've got sunshine and we don't over here. Is that what you're telling
We
me?
definitely have got some sunshine in South Carolina. So, there you go. It's a beautiful place.
Great. Well, it is lovely to get to chat um, because you're coming to Dublin in April.
I'm
And
excited.
absolutely. And I'm so am I because I've seen your stuff. I've seen you present in London, and it's going to be really fascinating. Do you want to give people a little bit of a background to Frederic Mao?
Okay, well, I've been in practice for over 20 years. I am a licensed mental health counselor. I primarily and a hypnotherapist. I'm board certified as a hypnotherapist and a trainer of hypnosis. I primarily treat anxiety disorders, traumatic disorders. I do a lot with functional neurological disorders, which is what we're going to be looking at with the conference. A whole lot with physical pain relief. Um, so it's pretty serious practice. And I just really enjoy the work. I think my presentations are typically known for the level of scholarship and like really drawing. It's a very clinical model. We're really drawing on the neurology of hypnosis. My perspective on this is to look at neurologically how hypnosis operates in the brain, and then to think about how certain kinds of diagnoses operate in the brain. And I think we've got enough information at this point where we can actually align therapeutic processes with the way the the diagnostic processes, the disorders operate, and so you can align your therapy with a disorder. And hypnosis is just a neurologically an excellent fit for actually most of the stuff that is in the diagnostic manual here, the DSM. Um, Over time, people have looked at my stuff, and so I actually am very excited right now because I am contributing to the upcoming fifth edition of Essential Psychopathology and Its Treatment, which is a standard psychiatric medical textbook that's published by Norton. And I know that my section on hypnosis will be included in the book.
Brilliant.
And I've also been invited by the lead author to heavily edit the entire chapter on psychotherapy. So I'm very, very happy about that. I
Excellent.
have served as medical faculty in a residency program for psychiatrists. So these are fully qualified and licensed physicians that could be your general practitioner or your family doctor, and they are getting their specialization in psychiatry. And so I was very honored to be invited to serve on that faculty and to teach hypnosis and psychotherapy to these physicians, to these psychiatric residents. And I was particularly honored with it because, like, my license is kind of down here, and their license is way up here when
Right.
with the way people look at licenses. And the take I took with them was, I'm going to talk to you about a little bit about neurology here. I'm not a neurologist. I'm not your neurology professor. I'm not a physician, so you're all smarter than me. But if I say anything wrong, tell me because I want to be corrected. What I want to do, though, is look at how this operates and then relate it to what that shows us about therapy. So it's a different look at neurology and a different look at therapy. And the feedback I got in the room was, well, one, it's accurate, and two, great, and three, we've never seen anything like this where this kind of connection is being drawn.
Would
I'm
I be
also,
wrong? Would
mhm.
I be wrong in assuming that in in that model that they will look at that they look at it as individual parts, whereas you're looking at it as a collective, or is that just too broad a statement?
When you look at high hypnotizability, which is actually a genetically inheritable trait, we know at this point, and we understand exactly how it operates in the brain. There are certain functional connectivities in the brain that go with high hypnotizability. Those same underlying neurological processes are involved in post-traumatic responses that are clinical anxiety disorders, unipolar depression, functional neurological disorders, um, tic behaviors like OCD or Tourette's, that kind of thing. They're not involved with things like schizophrenia, autism, which are not even related to each other, learning disability, stuff like that. And what I find is that hypnosis actually, high hypnotizability correlates with certain kinds of mental health diagnoses. And
Okay.
we are really good at treating all the things that we correlate with. It's not that hypnosis causes the problems, it's that the same underlying brain functionality is involved in both these disorders and in how our process operates in the brain. And so that alignment makes us super effective when we're dealing with things.
Really, no, and I get that. How did you get into hypnosis in the first place?
I lost a card game with the devil. Um,
I think you
no,
won in the end, though.
yeah, well, it worked out okay. No, I got laid off from my corporate job. I got a raise and a bonus and laid off 2 months later, and they laid off 200 people and closed the place down here. So it definitely was not my fault. And I was running around doing consulting work, and actually pretty quickly drubbed up some clients for that. But that's not full time. That does need all your time. And so I was doing things like going to Chamber of Commerce meetings to either try to find a job or to drum up more consulting clients. And I ran into a guy that owned a hypnosis place, and he was like, "You should come work with me. You'd be fabulous." And I'm like, "That is completely insane." But then I thought about it, and I thought, you know what? I'll bet that's really, really fun at parties. And it turns out this totally is. And so I went and did some work with him, and it was not a professional level of like the pay was not. It was like an hourly. It was not a professional level of work, and for an employee there, and they were doing things like weight loss and smoking cessation and stuff. It was definitely like a life coaching model, not a mental health model. But I really fell in love with it, and I discovered how powerful it was to help people create changes in their life. I actually had an injury to my back at that time that caused some severe chronic pain, and was able to learn about hypnotic pain relief and was able to use hypnotic processes to get rid of that and was super thrilled with it. So, kind of condensing the story, I basically ended up purchasing the practice
Right.
and just fell in love with it. And at at that point, people were started coming to me for more and more complicated things. And so I decided I needed to up my game and get some kind of therapy license. So I got my license as a licensed professional counselor, and then just rolled forward from there. So
And
that's kind of my story.
obviously, you focus a lot on pain, on physical conditions, on neurological conditions. Um, was your background medical before you got into hypnosis, or was that something that came through the practice?
No, this was completely different. Well, I did
Okay.
have some work that involved some lay counseling and that kind of thing, but it was not a medical model at all. So, so yeah, this is my career path has been quite a journey, but I'm very happy to be working with what I'm doing now, and like my clients are tend to be very successful and they get better, and it's lovely. So there you
And
go.
absolutely, and that is what it's all about. That's what we're all aiming to do with each and every client that walks in the door. Um, and so the model that you follow in terms of, say, when you work with pain or when you work with any, if you like, I'm just going to call it mind body connection, just for a general heading. But is that something you've developed yourself over time?
Oh, absolutely. I mean, well, I'm an Ericksonian hypnotist, and working within that model and from that perspective. Um, I mean, a lot of times I know people will ask, well, who trained you, and how did you get into this, and where'd you come from, and that kind of thing. And I sort of feel like I'm a kind of an orphan on all that. I mean, I originally learned with a guy that had been trained by Patrick Porter, who was the guy that did the Positive Changes Hypnosis Centers, which he was franchising hypnosis in the U.S., which in my mind is, kind of a wild idea, but he
Hmm.
got a little traction with it, and he was doing kind of his own version of NLP that he called psycholinguistics. But honestly, the training I got there was very basic, and I did have an opportunity after I'd been initially trained to like do like a weekend workshop with Porter, and he was really good. I still have some connection with him, and I've got a good bit of regard for him. But like I've never had anyone that was like a mentor, provided with a model. A lot of my work has depended on just my own research, understanding how the processes work. I've learned tons from my clients over the years, and different things like what works and what doesn't. And at this point, I feel like what I'm doing is sort of my own thing, but I don't have like I don't know a spiritual father in hypnosis.
Gotcha. No, I understand. And that whole connection where you work a lot with, say, FND, which is what, and let's have a conversation about FND, or at least not to take away from your talk at the conference, but because FND, as you know, is something that I work with as well. And it is that disconnect between the brain and the body. Now, what you're basically saying is that within the neurology, that there's some of those pathways just have, and you can explain it better from a scientific perspective now than I can. But do you want to delve into that just a little bit?
So, functional neurological syndrome disorder is when there is a medical symptom, but physicians have ruled out a medical etiology or cause. So, there's no medical cause, but there is a medical symptom. I just wrapped up work with a 12-year-old boy who had seizures. FND seizures are also called psychogenic seizures. And the idea of this is if you have seizures and you have epilepsy, they can run an MRI and they can see what's going on in your brain. And there's something structural going on with your brain that's structural that leads to the epileptic seizures. In other words, there's a physical problem in the brain that contributes to the epilepsy. When you're exhibiting seizures and they run the MRI, and nothing's physically wrong with your brain, like there's nothing there that's structurally wrong. People don't talk about structural neurological disorders, like that's not an actual phrase, but that's what medical things are. There's something structural going on in the brain. There's none of that. And so at that point, what we know is that the problem is a functional neurological issue. It's emotionally locked into place. It is an emotional expression that has a physical um, uh, symptom. And generally, I find that these things are actually caused by like some kind of conditioning, which kind of hurts my heart because I'm not a behaviorist. Like they're the other end of psychology from where I am, but rather than some kind of trauma. And I actually find that with hypnosis, um, functional neurological issues treat very, very quickly. I'll also point out something that we talked for a couple of moments, before we hit record on the interview. But when you go look at like the standard recommended treatment books of what to do with different mental health disorders, they're not treatments for FND. We don't have a good treatment in terms of counseling, therapy, or even medication for functional neurological disorders. Basically, there's not a lot you can do with it with a psychotherapy process. And medically, they just treat like the co-occurring depression with medication, but that's not dealing with the FND. And so hypnotherapy is fabulous at this. And like my young man that I worked with, the 12-year-old, I usually see clients for about 6 sessions. It's a brief therapy model
Mhm.
anyway. And that holds pretty true with a lot of anxiety trauma issues. I mean, with him, we were done in 3, which is real fast. Like I find that what we do with FND is extremely effective. It moves very, very quickly, and the processes are actually very straightforward. And to be honest with you, what I do with FND clients looks a lot more like screwing around at parties than what I typically do with a hypnotherapy client. So the whole, I should learn hypnosis because it'll be fun with parties thing
Right,
kind
there
of
you
turned out
go.
to work out okay for things.
Absolutely. And I'm particularly fascinated with this topic, not only because I work with it, um, and I work with, and I've seen that where, seizures have stopped and people hitting their heads and all the various stuff that they've done. And in my case, it's clearing trauma. Once that trauma is cleared, the body just knows what to do itself. The psychotherapy model, sorry, the medical model of the world here sounds very similar to the US. Psychotherapy and physiotherapy. That's literally what people are put into. But if the issue tends to be emotional at source anyway, then hypnosis is perfectly attuned to dealing with this. Um, and again, like the States, again, the only medication is for the anxiety or the depression or the side effects that come. And for people who are not familiar with FND, if someone's not able to walk or they're getting seizures or they're experiencing some physical pain that they don't know where it's come from, they don't know how to get rid of it, and there's no solution, it just causes severe anxiety in that person, and that can feed onto other stuff. So, but we're perfect. We have the tools to help. And I know there's very little research, at least in the hypnotic sense, on it, unless you know of more that's come around recently. But
No, I mean, there hasn't been a whole lot, and like it really needs to be there because I think we've got a solution to this that does not, like, it is not in the treatment book at this point, and it needs to be. And I mean, another thing to realize is we talk about hypnosis having a stigma and stuff like that, and it definitely has, and that kind of thing. But hypnosis in the United States, I mean, I'm not saying we're super popular here, that we've got tons of cred or anything like that, but we are not complementary and we are sure as heck not alternative. This is a standard of care process. We are really well understood. Like the neurology of this is really well understood. It is definitely not just like a conscious compliance thing, which puts us in the basket with cognitive therapy, which is just kind of stupid because it's not how it works in the brain. We are actually, in terms of pain relief, we're considered by the U.S. government not only to be standard of care, but to be a best practice. So we're a medical best practice for treating pain. So I do feel like the cachet of hypnotherapy is going up, that we are getting traction over time. I think the neurological studies that have, shown how it functions in the brain tremendously help with that. And
Mhm.
I think as lay hypnotherapists, if people are able to talk about how these processes function in the brain, which can be actually done very simple. You don't have to be a neurologist to do it. Like it will increase your credibility in conversations with physicians. It will increase your credibility in conversations with like potential clients because we live in an empirical world and people want to come in and they want to hear something that sounds like it makes sense for reasons that make sense. I've got a client that I'm working with right now who is a surgeon, and we sat down for our initial consultation, and I was like, "Well, are you a brain surgeon?" She's like, "Not so much." I'm like, "Well, okay. If you were, it'd be great to know." And so we kind of talked things through, and she's like, I wasn't expecting this, but it all tracks. It totally makes sense." I'm like, "Well, yeah, there you go."
Yeah, and I mean, I think that's a separate conversation that you and me might have about, because obviously that's something that I'm aiming to build with this conference, is to build that sense of not just rapport and community and knowledge and learning, but also to expand hypnotherapy and to start getting into, you know, to work with the medics, to get those involved, and to get people to recognize the power of hypnosis. So if the US are doing it, let's figure out, there may be some correlation that we could figure out. We'll have a conversation separate. But I know I've come across some research before that I think looked at almost, I think it was around 1,700 cases of people who had FND and had experienced hypnosis. And I think if I remember the stats correct, 85% of them got a short-term benefit, um, and 75% it had an immediate to long-term benefit in terms of all the solutions being, or all the symptoms
I
being
would
helped.
love that research. So I'll let you
I'll
send
send
that
it
to me
on to you.
offline. But that may make its way into my presentation if I get a chance to look at
I'll
that
send that
sometime
on
in
to you.
April.
I've used it
So yeah,
myself.
that'll be great. Yeah.
And it's something that was conducted over time, because there isn't, as you said, there isn't that focused research in those groups, but it was a peer-reviewed process of, I don't know, 2,000 cases or something that had been recorded.
Well,
Um,
which is just absurdly big for a study. I mean, like if they have those numbers, that's just, I'm not doubting you. Like, I'm just like, awesome. That's celebrating that because that's
no,
like
I'll get that over
huge,
to you.
his numbers. Yeah.
Um, because I know, and you know, you and me spoke before, and one of the things about FND is that hypnosis is perfectly able to help. There are loads of people out there who have no solutions and who are crying out for help. And
Yeah. I had one client that had this was not the young man I was talking about earlier, but had psychogenic seizures, and she actually had a seizure in the neurologist's office, and he yelled at her to stop. Well, I mean, that's it's not going to be clinically
it's not
effective. Like
exactly
yelling at
helping.
your patient is not like that's not a way to go. But I've had all kind of presentations with this, people that couldn't talk. One woman that if you startled her, she would just flame flat out pass out. I've had people that couldn't swallow. I've definitely had FND pain, and like hypnotic pain relief is so straightforward and so effective. It just works so very well that, like, when you're doing it and it's not working, that's like a red flag of what's going on. And what I've generally discovered is if I'm doing my normal pain relief stuff and it doesn't work, then I begin to suspect that what we've got is an FND presentation. And I kind of shift what I'm doing over to that, and I found that to actually be effective. So I've definitely have had FND pain that we've treated. So that's, there you go.
Yeah. No, I'm looking forward to the presentation. Your presentation is about the inductions that lead into it, but you're also dealing with FND and pain during that. Is that correct?
Right. Well, the thing that I end up doing with FND clients is I end up doing rapid induction, just like you would do at like a party where you're like, look at my fingers and gee whiz and sleep and stuff. And like, I never do that with clients. Like, hypnotherapy, you come in, you sit back in the chair, I talk you down to a nice relaxed state. I'm real boring, so people tend to nod off when I talk to them, and like it works beautifully. Like that's how I work. Like it's great. That is not. I have not found that model to be effective with FND at all. And what I end up doing with FND is just very fast, rapid induction and a lot of physicality. As a counselor in the United States, we usually don't physically touch our clients.
Mm-hmm.
Like that's not a typical thing. But I'm doing like arm catalepsy and a bunch of different things. So I'm going to show the techniques that I actually use, but I will definitely be talking a little about the neurology of FND and some different presentations and how it's played out with clients. So I want people to have a model by the time they get done with the workshop that they could actually go and go, you know what, I can go do this with my client.
That's exactly. And
like I kind of understand how this works, and I can just go do this with my client, and that is the goal. If you come spend like what is it, an hour? If you come spend an hour with me, at the end of the hour, you're like, all right, I can go do that.
Absolutely. And I mean, like I said to you, I'd made a presentation earlier a few months back, again, just to increase awareness of it and the fact that we all have the tools in which to do it. We just need a small bit of direction and a small bit of focus in terms of people who know what it is medically, how this works, and what works.
Well,
I'm
to
really
my mind,
interested.
there's some things we do that are very complicated. When you go out and you're treating like significant trauma, that's complicated. There can be a lot that's going on with that. But some of the most effective things we do are actually very, very simple, like pain relief and actual sleep issues, which are kind of rare. Usually it's an anxiety issue, but like pain relief and actual sleep issues are just ridiculously simple to do. And every hypnotherapist should be doing that. And FND is another thing that I would kind of put in that basket, that it's just very simple to treat this, and it tends to move really, really quickly. So it seems like a big, bad, scary disease, but in actuality, when you go to treat it, it just tends to treat really, really. You're going to be much more. It's much easier to deal with. It's not like smoking cessation. I mean, yeah, people just need to be doing it. Like, there you go.
Why, just out of interest, why do you use a different induction for FND?
So the FND difficulties are feel very involuntary, automatic, and they have a lot of physicality to them. Basically, all the problems that we're dealing with are limbic system driven, which is emotional processing in the brain. But with FND, the physicality of the symptoms is a key component that locks it in. And so those things feel totally out of control. The reason cognitive therapy doesn't work for it is that, like, there's nothing cognitively to manage. Like, the things are just happening to you. And so what I'm wanting to do is model for the person in a strong way a sense of involuntariness physically with the body, which actually looks different on neuroimaging than conscious, holding your arm out or whatever. And so that the person experiences my body locks up and does something and I can't move my arm. And then, then I'm able to, and then it comes back. And I think that shift from like the involuntariness of like the catalepsy processes, people just make the jump to, oh, well, my throat locking up or my seizures happening or whatever. That doesn't need to happen. Like it just kind of like
love it.
It models for the brain a different approach in a way that is completely non-cognitive. There's no cognitive learning going on here.
Yeah, no, I absolutely love it. And I understand now completely why it is you do that. I love it. Absolutely love it. Makes so
Yeah.
much sense
And,
when you
and I mean,
describe
you
it.
know, in honesty, I've just told you in like 30 seconds how my whole process works. So, you know, there are probably other good workshops going on while mine's going on, but you probably want a little more
No, but I'm in
detail to see how
yours.
to fill it in and how to actually do it. But like, it is actually that simple, John. Like, it's not a complicated process conceptually.
Yeah, yeah, no, I'm really looking forward to it,
It's
and
going
I'm
to be
so
great.
glad that you're both coming to Dublin for the very first time in Dublin, and also
Excited.
that you're covering this particular topic because it is something that every hypnotherapist is equipped to deal with.
It really, really is. I mean, we totally can do it. The other thing that I think is really important to me about this is I grow increasingly frustrated with the state versus non-state debate for hypnosis, and like the whole idea of non-state hypnosis at this point, it just has collapsed. Like in the face of neuroimaging, there is obviously hypnosis is a very different thing from cognition, cognitive processing. And by trying to say that we're just compliance and that kind of stuff, like what we're doing is we're losing all our specialness and we're putting ourselves in the basket with like cognitive therapies, which is not how we function in the brain, not how it operates, not anything about it. And those therapies can't do anything. They can't do diddly squat for functional neurological disorder. And so, you know, just reinforcing to people the idea that like, well, that debate is over. Like it's just over. If you want to see something that is a non-state process and looks just like cognition in the brain, you're talking about mindfulness, and that stuff is the opposite of us. Like it operates opposite in the brain. People that score high on mindfulness scales score low on hypnosis scales, and vice versa. Hypnosis is a different thing. It's operating differently in the brain, and understanding how it operates, I think, really opens us up to talk to physicians more effectively and really be much more effective in our treatment. I remember a Star Trek quote where Jim Kirk in one of the movies says, "You got to understand how things operate on a starship." And I'm like, that is exactly right. You need to understand how your process functions. And at the point where you understand your process, it's not that hard. Like understanding how this works is not, it's brain science, but it's not super complicated.
Yeah,
At
I
the
get it.
point where you understand how it operates, you become much more powerful, I think, in the ability to like do processes, understand your processes, connect with your clients, talk to your medical community. So all of that is in the fabric of what we're going to be doing when we're talking about FND. Like it's all right there.
I'm really looking forward to it because connecting with the medical community is something that I want the conference to do anyway, as part of what it is that we're aiming for, just to create that more awareness about hypnosis and its power and its potential to help people. Frederic, thank you so much for your time today. It's been really wonderful. And
John, I really appreciate it. And I really appreciate you inviting me to Dublin. Like there are a lot of people you could invite. And thanks for
it's
including me
going to be
along. Like I'm
wonderful.
delighted to
Like I
be in
said,
here.
I've seen you in London. I know how good your stuff is, and you're going to inform people and you're going to educate people. And it's just, you, you know, it is, this conference is about learning, it's about connecting, it's about expanding, and you're going to help with all of that. So I'm really grateful for you coming over. So I really appreciate it.
It's a beautiful thing to say. And just, I'll just say thank you again. I am super excited to be coming to Dublin and speaking on this topic.
Brilliant. And to everyone else, thank you so much for watching. Please do go see Frederic's presentation. It will be truly informative and you will learn so much about a topic that, as hypnotists, we are so able to help people, and there is no support out there for anyone at the moment. So, um, and you'll get the tools that you need in which to help that. So, thank you so much for watching. Thank you so much for taking the time today. We'll see you on the 5th and 6th of April. And all details are on www.irishhypnotherapyconference.ie. And wherever you are in the world, have an absolutely amazing day. Thank you.